Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Let's talk overcompensation today, and especially I'm going to share with you how when you tend to overcompensate, and I will explain what I mean by that, how when you tend to overcompensate, it tends to cause two very big issues that tremendously affect you moving forward. So let's discuss overcompensation. What do I mean by overcompensating? Well, for starters, when we're dealing with gender dysphoria, and again, that is when we feel incredibly incongruent with our biological sex and incongruency between our desired gender. When we feel gender dysphoria and we're going through that pain tends to fluctuate, right? Sometimes we wake up, we feel less dysphoric, and sometimes you wake up, you feel incredibly dysphoric. So gender dysphoria tends to wave in frequency and in duration. And as human beings, what you do is you tend to find ways to deal with that internal pain and internal struggle. That's just what we human as individuals tend to do. And one of the ways you find that helps you deal with gender dysphoria is overcompensating. And overcompensation is also incredibly common, especially in people who have not accepted yet their sense of gender identity, who haven't accepted they're trans. And then it's also very common in groups of people who have maybe have a notion or idea, or maybe even have accepted that they're trans, but haven't come out yet. So that tends to be a very predominant ways that we tend to cope with it in those categories especially. And it's especially more common for individuals that were assigned male at birth, but desire to transition to female binary, more than it is for individuals that are assigned female at birth, but desire to transition to male binary, although it's not that uncommon. So what is overcompensation and why do you overcompensate? Well, dysphoria, because it's incredibly painful, one of the ways you deal with it, like I said, is instead of going towards the binary that you want to achieve, towards the binary that you identify with, because it is too painful, it's too much, it's too overbearing, maybe you're not ready yet. What people tend to do is they tend to go to the extreme. Now they tend to overcompensate and over-engage in gender expression, gender presentation, and gender activities that relate to your biological sex, to your assigned gender at birth, to the part of you that you feel the most incongruence with. That's what you tend to overcompensate with. And the way you tend to overcompensate is that you tend to really exaggerate or take to the extreme the gender role. So for example, if you were assigned male at birth and you're not comfortable being man, what you're going to do is you're going to maybe express yourself in clothing that are overly masculine. Maybe you're going to join the gym and work out and build up a lot of muscle, accentuate your body build. Maybe you're going to join some kind of active activity such as team sports and become a leader of a team sport. In other words, you're going to do everything that you can to throw yourself into that gender and overcompensate by doing a lot of stereotypical activities associated with that gender. And the same thing is going to be true for anybody who doesn't feel comfortable with their female gender assigned at birth. They're going to throw themselves into that activities and they're going to over accentuate their femaleness. They're going to be almost like a high femme exaggeration of a female gender. And the reason why we tend to, or you tend to overcompensate and you tend to throw yourself into it is twofold. Well, on one way, what you're doing is that you're trying to tell yourself in a way by overcompensating that maybe you're really not trans. Maybe if you over-identify here with all of these activities, right, a sense of over-identification takes place. If you over-identify, then maybe you're truly not transgender. And the danger of that is that you over-identify to such point where you start questioning if maybe you're truly not trans. It starts bringing up a lot of questions within your mind because you look at yourself over here and you tell yourself, but wait a second, how can I be trans if I look this way, if I'm able to participate in male-dominant sports, if I'm able to participate in male-dominant activities, if I'm able to, exaggerate my maleness, if I'm doing such a good job taking on this male persona, how can I possibly be transgender? So overcompensation, do you see how it leads to over-identification with the gender you most don't feel comfortable with. And that's one of the biggest problems with overcompensating, is that we tend to over-identify with it to an extreme. Another problem with overcompensation that tends to take place is that overcompensation tends to indicate to you, like I said in my masochism video, tends to indicate to you that you're able to live in this gender, in this personified gender that doesn't feel comfortable to you. When we overcompensate, it's almost like a litmus test where we prove to ourselves, see, I can do it. See, I can live this way. See, I can go and I can, pretend like I'm a man or pretend like I'm a woman, and I do a pretty damn good job at it, and nobody blinks an eye, and nobody questions my gender. And if nobody questions my gender, and if I'm able to live my life this way, then maybe I don't need to transition. So that's another danger of overcompensating, is that it normalizes pain for you to some extent, where you tell yourself that, even though I'd like to transition, even though I don't feel comfortable with this gender, I'm doing such a good job faking it. I'm doing such a good job playing and acting like a man or playing and acting like a woman, that why bother even going over here? So overcompensation, as you can see, is very dangerous. It's not really helping you to live to your full potential. It's actually holding you back quite a bit. And again, one of the biggest dangers of it is that you over-identify with it to the point where it becomes okay, and then you over-normalize it to the point where you start telling yourself you don't need to transition. But all of the things, all of this over-identifying and also normalizing, they're just our mind maneuvers. They're just our ego ways of protecting the status quo, because our sense of self, the bigger ego, doesn't want us to change status quo. It doesn't want us to rock the boat. So it will do everything that it can to maintain status quo, because the change that's going to come is so terrifying and so scary and so threatening to us, so threatening to the environment, the cocoon that we have created, that we're going to try to maintain it at all costs. So if you find yourself overcompensating, I want you to stop, and I want you to ask yourself, what am I doing here? How long have I been overcompensating? And at this point in my life, is this serving me or is this not serving you? And chances are you're going to find out it's really not helping you. Chances are you're going to find out that it's leading you down the path of over-identifying with that, and it's leading you down the path of questioning your gender even more. And that's really not helpful. So if you're watching this and you know exactly what I'm talking about, comment below. Have you experienced overcompensating by over-identifying with the exact gender you don't feel comfortable with? What effects has it had on you? How has it maybe led you to prolong your transition, or maybe to even just prolong the pain you experience with gender dysphoria? Because I don't really think that overcompensating takes away pain ever. I think what overcompensating does is forces us almost to this part where we kind of temporarily, for a short period of time, go into this magical thinking where we believe we're not transgender, and for a few seconds the world seems to be okay. But that's almost like a casting a little this glossy overview in front of us, putting on kind of a rosy glasses. It's not really a true picture, a true representation of your relationship to your gender. So comment below, let me know if you did overcompensate, what effect that overcompensation had on you. How did that affect your life? And or how still, if you're overcompensating, and I'm sure many of you are still overcompensating, how is it still affecting your life? So let me know. I read all of your comments. I comment to all of your comments as much as I can. So I really am highly engaged with the conversations that we have going on. So comment below, and would be very happy to engage with you. And I'll see you guys all next time. Bye.